Hi, so I'm going to be talking about mastitis. Now, mastitis is something that some women do worry about if they are choosing to breastfeed, because if you do get mastitis and it's not treated, then it's not very nice. I'm going to admit that. So I'm really keen on people being aware of how mastitis presents itself, how we can actually prevent it, and what we can do to treat it. Okay, so mastitis, what it actually is blocked ducts which become infected. How does it present itself? Well, what you can get red patches on your breast. You can feel flu-like, and obviously your breast is probably going to be engorged as well with milk because the milk is not being able to be released. So if you're feeling flu-like and you have this red patch on your breast, then please marry the two up. What us women do is that we just kind of soldier on. We're not feeling very well and oh, I'll be okay. But if you are experiencing that red patch and you are feeling flu-like, then please, as I say, do marry the two up. And what we can do with it then is carry on feeding your baby. Sadly, there is lots of information out there, or sadly some healthcare professionals as well, saying stop feeding your baby if you get mastitis. This is possibly one of the worst things that we can do. Just imagine if you have a blocked duct and your milk is continuing to be produced, just imagine what could then happen. So what we must do is continue the release of that milk by carry on feeding your baby. If you're unable to feed from the breast, then please do express. Maybe hand expression may be a little bit easier for you, rather than the pump, but just see how you go. So you carry on feeding. Now, after 2 feeds, and also what we'd recommend is you're having a warm bath and taking some anti-inflammatories as well. This is obviously if you are not allergic to them, so please do speak to your healthcare professional as well before actually doing this, perhaps your health visitor or your doctor. Now, after 2 feeds, you should start to be feeling better. If not, then please do go straight down to your doctor's and get an emergency appointment. Do not wait, and he should be able to prescribe you some antibiotics. As I say, if we catch mastitis quickly enough, then you do tend to feel a bit rotten for a couple of days, but then it is easily cleared. So how in the very start off do we actually stop ourselves from getting mastitis? Well, breast care, lots of it. Make sure your baby is feeding lots. Make sure you feed your baby when you feel full. So your baby may have just fed and they may be asleep, but if you're feeling full, pick your baby up and let them feed from the breast. So it's a lot of self-care as well. Don't just be responsive to baby's needs, be responsive to your own needs as well. Always have a hot bath. If you're getting lumps in the breast or under the arm at all, then massage these through, massage in a hot shower, and this can just be the gentle release of milk as well. So this is how we can actually prevent mastitis in the first place, always making sure that our breasts are soft to a certain degree, okay, not letting them get too engorged, and responding to the baby's needs as well as the mother's needs. So I hope that helps with just, again, a roundabout view of mastitis. But again, anything worries you, then please speak to a lactation consultant or your healthcare professional to give you more help and advice on this matter. So I hope that helps. You take care now. Bye.